We're following a big story that will affect all Ontarians. The provincial government just outlined its prescription for how to improve the Medicare system. Health Minister Christine Elliott says her government's goal is to make healthcare more patient-centered, those are her words, and reduce so-called hallway healthcare. Here's some of Elliott's news conference at Bridgepoint Hospital.
Through Ontario health teams, patients would finally have a say in their healthcare journey. With safeguards in place, of course, to protect information, patients would have an option to securely access digital health services, such as making online appointments, talking to a specialist virtually, or having access to your own electronic health records. And a great part of Ontario health teams is that they will rely on leadership that already exists in our community, rather than create another level of bureaucracy and management.
CBC's Megan Fitzpatrick was at that news conference. We've got her right here in studio now. The minister calling the current system siloed and fragmented, not positive words to use. So then she came up with a plan to improve it. What was at the heart of that?
Two key things really is what they were announcing today to reorganize how healthcare is delivered in this province. The government plans to introduce what they're calling Ontario Health Teams. And this is a way, they say, to better shepherd patients through the continuum of care. So really the idea behind it being no matter what part of the healthcare system you need to use, that you will be better cared for, whether it's in a hospital, your primary care family doctor, if you need mental health care. The idea is to connect all those providers through one team. And so the government is encouraging local healthcare providers to come up with a proposal on their own. They're going to set some rules, set some criteria, and then those teams can apply to the province for funding, essentially, to provide that care. So more details to come on that, Suhana, but that's one of the key things that they're announcing to try and better deliver more patient-centered care, as you mentioned. The second key thing they announced today, what they're calling a new agency called Ontario Health. They plan on collapsing a number of existing agencies, right now known as local health integration networks. And they are meant to coordinate care right now in the community, like home care. They're going to merge all of those under one umbrella, along with a number of other existing agencies like Cancer Care Ontario, the Trillium Gift of Life Network. And again, this is the idea is to break down these silos, to eliminate duplication among agencies and cut back on some of the bureaucracy. So those were the two main headlines out of this morning's announcement, how they plan to overhaul how healthcare is delivered. Christine Elliott made a point of emphasizing her government does not plan to introduce more private health care in Ontario. Take a listen to the Health Minister.
One thing I do want to make very clear is our government's commitment to the fundamental right of Ontarians to universal access to a publicly funded system of health care. To me, that is part of what is being a Canadian and being a very proud Ontarian. That's why throughout our government's process of developing a vision for our healthcare system, I do want to say very clearly and directly to the people of Ontario that our primary objective has always been and will always be to strengthen our publicly funded healthcare system. And that means paying for your services with your OHIP card.
So she's telling patients not much will change for them. They'll still go to their doctor's office, show their health card, their OHIP card, and it should be seamless through this transition process. And then at the end of it, when it all takes place, she is saying this isn't going to happen overnight. This will take years before all these changes they're announcing today will actually be enacted. And they have to put this in legislation and pass that through the legislature. But of course, the Doug Ford government does have a majority at Queen's Park, so that shouldn't be a problem for them. Reaction yet? Or is this still being digested? Yeah, it's still coming in, but these changes were anticipated. There have been quite a few leaks over the last few weeks in various news reports that this super agency was coming, and there were various healthcare stakeholders at the announcement this morning providing reaction. The Ontario Medical Association, for example, was there. I had a quick chat with their representative, and they're saying in general they like the idea of more integrated healthcare. This isn't a new idea. People have been trying to do this in probably in most provinces for a long time. So she said, Wraparound healthcare, that idea is good. She wants to see the details, though, and those will come later in the legislation. Some concerns, Suhana, about job losses. If you are eliminating agencies, consolidating them under one umbrella organization, doesn't that mean job losses? That question was put to the health minister multiple times during the news conference, and she did not have a direct answer. She tried various ways of answering it without talking about job losses at those agencies, nor did she have a dollar figure about how much money this might save the overall healthcare system. She was emphasizing the government is going to be spending money in a better way, a more efficient way, not necessarily less money spent for patients. And she was again saying that it's one of her government's priorities to invest in frontline healthcare workers. But again, the question was, what about the back office workers at all those LHINs, at Cancer Care Ontario? And we don't know that yet. And that is one concern that was expressed by the union representing some healthcare workers. They quickly put out a news release after the announcement saying they plan to push back on this restructuring. They're not happy with what they're hearing about it so far. But again, more details to come when we see the legislation, and there is a technical briefing later this afternoon where we might get a better understanding of exactly how this transformation will take place.
All right. Thank you so much, Megan.
You're welcome.
Natalie Mehra is the executive director of the Ontario Health Coalition. Should tell you that's an organization that advocates for universal public health care. She's right here in studio. Welcome to the program.
Thank you.
You know, cutting down bureaucracy, making a team approach, getting rid of silos, all sounds pretty good as a patient.
Yeah, the minister is using very carefully chosen language, coordinating services, a team, etc., to cover for a piece of legislation which, in its leaked version anyway, and she hasn't distanced herself from that at all, gives the minister and the government brand new powers into this super agency that they are creating to order the privatization of significant chunks of the healthcare system, to facilitate mega mergers. Every merger under this legislation has to be a mega merger. It has to be two major services.
Where are you getting this?
It's actually written into the draft legislation that was leaked three or 4 weeks ago by a civil servant who was deeply concerned about it. And at the, all of this time, the minister, although she's tried to kind of obfuscate and skate around the issues, has never actually denied the substantive issue here, which is that these are new powers to order restructuring and privatization of healthcare.
You've been in the game long enough to know that draft legislation and final legislation can be completely different. One can be A, one can be Z. So perhaps there's some room in there. But and you're probably rolling your eyes at me, but I'm taking it right now as the minister saying, pay with your OHIP card. That doesn't sound to me like privatization.
Yeah, so what she's trying to kind of skate around is that the legislation gives power to the minister and to the super agency that's being created to order the privatization. So that is the transfer from public and nonprofit to private and for-profit healthcare support services, other types of services, the mega mergers of our hospitals, our local hospitals, long-term care, home care, the privatization of our home care, and so on and so forth. That is all in the draft legislation, which, has been on track according to their schedule and is being introduced according to their schedule. I don't think at this point we're going to see major changes to that legislation that will actually come out at 1 o'clock today.
And Natalie, help me to understand how this could change life for patients, because I mean, I've been a patient. I'm sure you've been a patient in the healthcare system, and hope to never be again. And I hope you're not either.
Yeah.
But there are times when you just end up there. And really all you want to do is get better, and you want somebody to help you get better. How is that going to change from my perspective as a patient?
Well, I think when people in the provincial election, Doug Ford traveled around to donut shops, and he met with our members and with people, the public all over the place, and he promised that he would end hallway medicine. I think what people wanted was that people lying on stretchers in hallways and hospitals would be dealt with, that the 33,000 people that are waiting years for access to nursing homes would be dealt with. I don't think anybody voted for the privatization of our public and nonprofit health services or for a major round of restructuring. And we've seen this before. I mean, bigger is not better. It has not helped our hospitals. We have more vice presidents now and less hospital beds than any province in the country. We have lost dozens of local health services, local hospitals.
And what
have
about
been put
jobs?
at risk. same thing. I mean, if you transfer services, if you create mega mergers, all of the workers over here have to get laid off, be paid severance, so on and so forth. They need to be transferred to a new place. There's shortages of all kinds of categories of healthcare workers. So the new entity tries to hire them up. It's massive displacement. And this is very like the Harris-era restructuring, only then it covered just local hospitals. Now it's all hospitals, long-term care, home care, the entire health system. For us, we're deeply concerned it will take billions of dollars away from care for restructuring instead of actually what the government promised, which was to improve access to care.
Right. One of the things that is apparently working in Ontario is cancer care.
Yeah.
And that system is... she talked about sort of a renowned cancer care system as one of the things that is working. But let's listen to what the minister actually had to say on this. Here's Christine Elliott.
Cancer Care Ontario has built some of the best disease management programs for cancer and renal indications in the world. Imagine if we could replicate those achievements to correct the inequities that have led to the development of such a world-class cancer system.
So here, Natalie, is the minister saying things are working in cancer care. Let's replicate that to other, avenues of need. Can that not be done in this system she is proposing of teams and community care working together?
Well, the minister is using the language of teams, but what is actually laid out in the draft legislation and in all the documents following that for the Ministry of Health is that they're going to take proposals from companies, they could be for-profit companies, that would be able to merge, take over, lead to the closure of a variety of healthcare services. That is not what Cancer Care Ontario does. It has never been what Cancer Care Ontario does. I think that's incredibly misleading. We do have a stellar cancer treatment system, and I think the minister is trying to, engage in some public messaging to cover really what this bill has done. We're outraged at the process here.
You're waiting for that legislation.
We're waiting for the legislation, but I think we know very clearly what's in it already, and I think what we're going to have to do is really now fight against the privatization of our healthcare system.
All right. Can I make this proposal that we go through that legislation when it comes out, not in its draft form, because again, things could change from draft. Even when you send an email, you change a draft. Why don't we chat about this again? Because I think it would benefit our viewers to know exactly what's in that legislation and then what the ramifications could be. Because right now we're speculating. Wouldn't you agree?
Yeah, we're speculating based on, I think, some pretty good information. To be fair, we have the draft legislation. We have subsequent documents that run up until last month from the Ministry of Health and Long-Term Care, internal documents about how it's going to work. So we have a fair amount of information, to make predictions about what's going to happen. But yes, I would love to talk with you more about it. The legislation will be introduced at 1 p.m. today.
All right. I appreciate your time, Natalie.
Thank you.
And your patience. Natalie Mehra is the Executive Director of the Ontario Health Coalition, and she's right here in studio.